Good evening, everyone. Anaemia Mukt Bharat is not just a slogan, it's a national contract. According to the National Family Health Survey, round 5, over 57% of women and nearly 67% of children in India are anemic. Staggering figures that underscores the urgency of our efforts. Aligned with the Government of India's Anaemia Mukt Bharat mission, this virtual national campaign, Anaemia Mukt Bharat Next Generation IV Therapy, organized by Voice of Healthcare and powered by Zydus Life Sciences, aims to amplify public awareness, promote clinical dialogue, and explore next generation IV therapy solutions for effective anemia management. Our speakers for today's discussion are Dr. G. Vamshi Krishna Reddy, Director-Oncology Services, Consultant Medical Oncologist and Hemato-Oncologist, Yashoda Hospital, Hyderabad. Welcome, Dr. Krishna Reddy.
Thanks, Dr. Manisha.
Dr. Santosh Kumar Chilapuram, Consultant Medical Oncology and BMT, Star Hospital, Hyderabad. Welcome, Dr. Santosh. Dr. Sindhura Durga Chittikela, Consultant Medical Oncology and Hemato-Oncology, Star Hospital, Hyderabad. Welcome, Dr. Sindhura.
Thank you, Dr. Manisha.
Dr. Sudhir Reddy, Medical Oncologist, Omega Hospital, Hyderabad. Welcome, Dr. Sudhir. Dr. Srinath Bhardwaj, Consultant Medical Oncology and Hematology, Apollo Hospital, Hyderabad. Welcome, Dr. Srinath. And Dr. K. Madan Gopal, Advisor and Head, Public Health Administration, National Health System Resource Center, Government of India. Welcome, Dr. Madan.
Good evening.
So before we start, let's have a quick poll from our audience that have you ever felt tired or weak for no obvious reasons? Type yes or no in the chat box. Okay, so my first question goes to Dr. Krishna Reddy. From your experience in oncology and hemato-oncology, how often do you encounter anemia as a comorbidity in cancer patients, and what unique challenges does it present in treatment protocols?
Yeah, at the outset, I'd like to thank Dr. Manisha and Zydus for bringing an important topic which is least discussed in our circles, because most of the times we are more uh, concentrating on treating cancer, and at the same times this anemia is something which is probably towards the last it is addressed. And as Dr. Manisha said, I think anemia is one of the most important comorbidities which we see in our patients. And yeah, it again depends on the cancers you are treating, because if you are treating hematology, like the liquid cancers or the blood cancers, which we call, anemia is part and parcel of the hematological malignancies. But in a center like where we treat both the liquid and solid tumors, anemia is a significant comorbid condition, and it also happens when we see patients with GI malignancies, and also as most of the times cancer is a chronic disease, it's like associated with a chronic inflammation. So anemia, if you are taking the incidence in oncology, it's I think more than 50%, and I think most of our papers in India also are going towards that. So by definition, I think if we are going with the classic cutoff, I think more than 50% of the patients do fall into the anemia category. And the next question is, how do we treat them? I think it's not a single drug or a single line answer for that. It depends on the age, the comorbid conditions the patient has, and we also do the typical iron studies. And depending on the malignancy, we see their erythropoietin level, the blood hormone level, and decide which therapy has to be given. And most of the times, as we do for normal people, the oral iron supplementations are usually not very well tolerated, because the cancer therapies usually cause a lot of nausea, and patients don't have a tolerance to oral iron. So this is an area where probably most of the times the parenteral iron or the IV iron medications is suited for our patients in oncology. mainly for the reason that it's not wet, the oral formulations are not well tolerated, and also the speed with which we want a response. So the oral medications have a time lag before the hemoglobin jumps. So if we are giving the parental iron, we see the response quite early. Within 7 to 10 days, we see the response in the reticulocyte count and hemoglobin. So when we want a faster response, we usually try to go with the parental iron. And the last is about the transfusions again, which has its own pros and cons, which we usually try to avoid most of the times when we are treating our patients, unless it is an emergency where the hemoglobin is very low, where we need to transfuse them to bring the levels survive.
Right. Rightly said, sir, that cancer is a predisposing factor for anemia, and definitely we have different modalities, and depending on how swiftly we want the response, we can use it. So my next question goes to Dr. K. Madan Gopal. How do you evaluate the progress of Anaemia Mukt Bharat initiative so far, and what systemic shifts are still needed to accelerate results, particularly in underserved regions? And with the advancements of newer therapies like IV iron therapy, how can government health programs integrate these solutions effectively?
Okay, thank you, Manisha, and thank you, Voice of Care. So, because I am at the airport, so thank you for accommodating me for this thing. The Anima Mukt Bharat strategy launched under the Poshan Abhiyan in 2018 aimed to reduce anemia prevalence among women and children and adolescents by 3 percentage points per year. Over the years, the Anemia Mukt Bharat has helped in mainstreaming the anemia prevention and control within the RMNCHA network. We have made progress on several fronts. Wider coverage of iron folic acid supplementation through various platforms like the schools, Anganwadi centers, and village health and nutrition days. Screening and testing services for anemia integrated into the routine health services, especially during antenatal care. Deworming awareness campaigns and dietary diversification efforts have expanded at scale. However, progress has been slower than expected, particularly in tribal and aspirational districts. According to an Ipsos study, 55% of women of reproductive age and 67% of children aged 5 to 59 years, highlighting persistent gap despite efforts. Systemic shifts include strengthening diagnostics at peripheral prevention. Many Ayushman Arogya centers still lack reliable hemoglobin screening point of view. The hemoglobin must be ensured across all these facilities. Better convergence and monitoring between the health, women and child department, education, and other stakeholders to ensure synchronization. The shift from input-based to outcome-based monitoring has happened. The real-time tracking of the hemoglobin levels post-therapy using digital dashboards using Ayushman Bharat digital mission should be considered. Customized regional strategies have been in place. Tribal vets and hard-to-reach areas need to have a differentiated portal. You take the example of PM General program as well as the use of the mobile medical units. And beside that, beside using this SHG-led outreach or linking with ASHA and the school teachers, it has improved the compliance of compliance of the uptake of the iron folic acid and the screening of the anemia program. As you rightly mentioned in the opening talk, that how many of the poll question which you have asked, that's rightly pertaining. That calls for the community engagement and it calls for a behavioral change. And we are addressing these deep-rooted myths about the iron tablets, improving compliance and promoting iron-rich diets among required. But we are trying to see that how more sustained efforts are required for this. Beside that, the stronger data is to be generated. So we are trying to see that the data which is generated in this Anemia Book Bharat is linked to the Anmol portal, the RCH portal, and the antimicrobial the dashboards which are in this Anemia Book Bharat dashboard which we are made. They're making more stronger analytical and other processes. The other question which you have asked about the advancement in the newer therapies like IV iron therapy, you would be very happy to note that in the government for the severe anemia, we have introduced the iron sucrose therapies and it's had now become a routine. the pregnant women who are detected as high risk pregnancy with severe anemia, they have been provided this iron IV therapy, and the results are quite obvious there. Iron therapy, especially the newer population like ferric carboxymaltose, offers a significant opportunity for treating. We are trying to see that how these newer iron preparations they are brought into the system. Besides that, to integrate such therapies within the government health program, several steps are needed to be taken. First is we have to see that how the treatment protocols in Anaemia Mukt Bharat are updated, and so the guidelines are updated. And now we would be happy to note that the ICMR and the DHR they have carried out uh, intense implementation research to find out what is the amount of the dose which is required and what needs to be done to improve the compliance and acceptance of these therapies. The other thing which we are doing is building capacities across all the level. That is training the medical officers as well as the peripheral medical officers in the CSCs, FRUs in the sub-district hospital, as well as training the health workers in identifying the high-risk pregnancy patients. Besides that, we are also ensuring the infrastructure and others are also ready. If you go to sub-district hospitals, CSCs and others, you will be finding many of the states that they would be having an uh, iron sucrose injection room. So that is there. Then, apart from that, to make the availability of all these drugs, the procurement of this medicines has been streamlined. Apart from that, we are using the PMJ and panel hospitals for providing treatment to many of the anemia patients, and that is there. Then we are doing many pilot trials. I mentioned that the implementation research is happening to the ICMR network. We're trying to demonstrate pilots and see the importance of introducing iron IV protocols in the select districts, and the results are very encouraging. So, besides that, lastly, we are trying to see that how we integrate the data which is generated through these pilots and other things into our health management information system, which is linked with HAVA, so that this can be uh, so that the post-infusion hemoglobin changes and other things can be done. By combining these preventive strategies and like IFA and the deworming within and the timely IV intervention for the severely anemic patients, we are trying to see, we are trying to reduce the burden of moderate and severe anemia in the patient and the consequences associated with. Thank you very much for this opportunity. Thank you.
Thank you. Thank you, Dr. Madan. So, my next question goes to Dr. Santosh. That bone marrow transplant patients can have complications like anemia. Could you share how anemia is monitored and managed pre and post bone marrow transplant, and where IV iron therapies fit in this journey?
Yes. So, a very good question. So, I really appreciate for having me at your podium of Voice of Health. So, this concept of bone marrow transplant is not for a single disease. It's for a multitude of diseases. So, suppose in one scenario, there is a disease known as aplastic anemia, where the formation of iron from the body or the blood from the body is a problem. So for that, we do bone marrow transplantation. And whenever a patient who is planned for bone marrow transplant or who already underwent bone marrow transplant develops low hemoglobin, so we obviously look for is the low hemoglobin because of low iron in the body or not? Because at that scenario, we have multiple causes for low hemoglobin. Suppose if the bone marrow functioning is not adequate, also in that scenario, also we might have low hemoglobin. If after evaluation we found that the low hemoglobin is because of low iron, definitely yes, the treatment would be IV iron, and we would like to have the safest form and the fastest form of iron formulation to be used in that scenario. So if you ask me, the proportion of patients planned for bone marrow transplantation or after bone marrow transplantation requiring iron would be around 10 to 20%. So around 80% of causes of low anemia in this scenario would be other causes in the form of low bone marrow functioning, or the blood that is produced might undergo lysis, that is hemolysis and all. There are multiple causes. Yes, iron deficiency still remains one of the important cause in this scenario also, but we have to evaluate the cause and later proceed for iron rather than blindly giving iron in this scenario, where these are a special niche population of bone marrow transplantation. Identify the cause, and treat accordingly, where it would be around 10 to 20% of all cases of low hemoglobin in this setting.
Very well said, sir. Bone marrow transplant reasons can be different, and especially anemia because of iron deficiency, which is like 10 to 20%. That can be addressed with the help of IV iron therapies. So, my question to my audience: did you know that iron deficiency is one of the most common health issues in India? Type yes or no in the comment box. All right. So next question goes to Dr. Durga. As someone working at the intersection of medical oncology and hemato-oncology, how do you see newer IV iron formulations improving patient outcomes in hospital-based anemia care?
Yes, thank you for making me a part of Voice of Health, and I'm keen on taking this question. So, in the intersection of medical oncology and hemato-oncology, as you have said, the most common causes of iron deficiency anemia that comes to our setting is GI cancers, that is stomach cancer, colon cancers, or esophageal cancers, who have a component of GI bleed, and that results in an iron deficiency anemia is one common setting. So these are the patients wherein the oral formulations may not be tolerated well, and we are in need of IV injections. So the previous older versions of IV iron or the parenteral iron was like it's a scare because primarily because of the infusion reactions, because of the older iron formulations. But with the development of the newer IV formulations, the ease of administering IV iron has become so much that we often prefer using IV formulations, and the allergic reactions have sort of been negligible since the time we have started using the recent most IV formulations like the ferric carboxymaltose or the ferric isomaltoside. So in our setting, those who are present with such type of anemias, yes, we often use this IV formulations, the newer ones, and wherein we can just administer the dose within 2 or 3 sittings, and the iron deficiency is usually corrected. So it doesn't require a prolonged infusion time or repeated admissions, repeated infusions, and the ease is again the most important thing that we find.
Right. So allergies are less and ease of administration. Definitely, this is one of the biggest advantages. So, Dr. Sudhir Reddy, in your clinical practice, do you believe anemia is still underdiagnosed or undertreated? What do you feel is the biggest awareness gap among patients or general physicians when it comes to anemia? So, please unmute yourself. Yes.
Can you hear?
Yes.
Yeah, yes. Yes, I do agree that the anemia is majority of the times underdiagnosed and undertreated in our clinical settings. The main reasons for this is because anemia, most of the times anemia presents with some non-specific symptoms like fatigue, weakness, shortness of breath, which are majority of the times are attributed to the underlying disorders like uh, cancer or some other chronic diseases. So we miss this diagnosis. Second important point is lack of routine screening in high risk population like adolescents, pregnant women, or elderly women, elderly people, and menstruating women, chronic kidney diseases. And these patients, if there is no proper screening, and we can miss the diagnosis of anemia. Third most important point is delayed workup. Even though anemia is diagnosed, most of the times general practitioners stop at the point of anemia being diagnosed, and they consider this as a diagnosis rather than a clue for the underlying disease. So anemia is not synonymous with the diagnosis. There should be some underlying, this should be considered as a clue, and there will be some underlying disease which has to be identified and treated, so that the cause is treated, anemia will be corrected. Next thing is, most of the time this anemia, iron deficiency anemia is considered as synonymous with the dietary deficiency, which is not the case. So there may be many other causes like malabsorption syndromes, like Crohn's disease, inflammatory bowel disease, occult GI blood loss. So all these things can lead to anemia, and not the only. I mean, dietary deficiency is not the only thing which is reason for iron deficiency anemia. Majority of the times, tolerance of anemia in chronic infection. Suppose if there is a cancer patient or some chronic kidney disease patient, majority of the times if that particular patient has got anemia, we'll attribute that symptom to the part of the disease, and we'll neglect treating that particular disease, anemia. So are completely work up. There might be some reversible cause also associated with those particular chronic conditions, so which needs to be identified and then treated accordingly. So when it comes to other important factors, like there may be some disparities because the underprivileged population will have anemia. They may not have some logistic support when it comes to diagnosis, when it comes for evaluation, and even for the management of the anemia or the underlying causes. So what are the contributory factors for this particular thing? So even from the patient's aspect, patient side, majority of the times patient considered that I'm just tired. They don't feel like going to a doctor and get it evaluated because they feel that it's just tiresomeness and they're not able to do the routine activities. So if they take that particular symptom as a serious symptom, they'll go to a doctor and then get it evaluated, and the anemia can be diagnosed and underlying disease can also be diagnosed. So I think these are the important things, and then we can close the gaps by creating a lot of awareness among the general population, so that they can detect these particular uh, symptoms, regular symptoms, which are neglected.
Right. Rightly said, sir. And the symptoms can be, very vague, and you can simply feel tired, and they could be fatigued. Just don't ignore it. There may be some underlying cause, and you may have low hemoglobin. Dr. Srinath, could you highlight some specific cases or insights from your work at Apollo where timely anemia diagnosis and IV therapy played a transformation role in patient journey? Please unmute yourself.
Sorry. So, because you're asking me about the hospital setting, I think we monitor patients quite often. It's not like the society setting where we need more programs like this to spread awareness, catch people who are really anemic and treat them. In hospital setting, there is a lot of monitoring, especially in our department, where we treat a lot of cancers, blood-related disorders. It's almost like you'll be surprised the patients are monitored for their hemoglobin daily. So it's like I can't point out at one case, but definitely IV iron helps us in getting a quicker rise in the hemoglobin, and for all our treatments to work well, especially when you talk about radiation for cancers. So the hemoglobin level to be maintained is very important. So it's not about a single case, but the IV iron plays a very important role in our practice. And talking about pregnant women with anemia, so you don't have time to give them oral tablets and wait for months together to for their hemoglobin to improve. So for a quicker improvement in hemoglobin without any risk of transfusion, IV iron definitely plays a key role in so many lives. And I can cite my own wife's example where we had to give IV iron before delivery so that the hemoglobin is well maintained. So yes, IV iron definitely plays a very vital role in today's practice in the hospitals.
During pregnancy also we can use it, and since iron deficiency anemia is so common and pregnant females, they need this, so IV iron therapy is again easy way of quickly raising the hemoglobin. So I would like to ask my audience that have you or someone in your family ever been diagnosed with anemia? If yes, please write yes. If no, you can type no as well. But definitely, you should be aware of iron deficiency anemia. What is your hemoglobin level, and how can you, raise the level and come to a conclusion that what is the cause. So just go to the doctor if you feel fatigued, if you feel tired, and if you feel that there is some underlying cause. I repeat the questions once again. Have you or someone in your family ever been diagnosed with anemia? Please write yes or no. This is an awareness campaign. Do study about anemia. Do know that there can be an underlying cause. Please don't ignore it. Okay, my next question goes to Dr. Krishna Reddy. What role can hospital-based oncologists play in contributing to public awareness initiatives like Anaemia Mukt Bharat, especially for high-risk groups like cancer patients?
Yeah, the first thing, most of us oncologists who are on this forum, we participated in a lot of public awareness program, mainly for the World Cancer Day, to increase awareness about the cancer and the treatment part, and to say that the chemotherapy is safe, and for probably equitable distribution of care. So all these are probably, we have good number of campaigns which are created to create awareness, and to see that the care is reached to the appropriate patient. And coming to the anemia part, as I already discussed, so this is something which is very much common, and most of the times the patients do attribute their fatigue or weakness to the cancer or the treatment. So what people do miss is that the anemia per se will cause a lot of weakness, which is perceived as fatigue, and that acts as a hindrance to receive the further treatment. So patients and the attendants, their family members should be counseled that maintaining hemoglobin level at least above 11 for our population is ideal to complete the treatment and also have good quality of life. And this awareness should spread across the forum. So I think with this Anemia Mukt Bharat, which is one of the awareness campaign run by Zydus, I think we need many more campaigns in our hospital. And I think anemia is not something which is very uncommon in our diagnosis. I think I can also that all of us have a good number of patients who do have anemia. So it's only like how do we treat them, because most of them I think are afraid of the side effects of parental iron, uh, probably, and they're not able to tolerate the oral iron. And with the other side effects of the hemoglobin stimulating hormones, we call them as ESAs, that has is less favored now in oncology. So most of us are comfortable using iron, or again, if you are giving blood transfusions, we do have the risks of contracting the comorbidities of thrombosis and other issues which can happen with blood transfusion. So we do blood transfusion only when it is absolutely required. A faster rise in hemoglobin is required with the associated risk. But most of the times, patients should be suggested for parental iron when their iron studies are appropriate and suggestive of iron deficiency. And also, last but not the least, the diet should also be inculcated to improve the iron-rich food, uh, which again are probably going out of favor, because most of us are pushing towards the medicines. So diet is also one of the contributing factors which helps in maintaining their hemoglobin level. So campaigns are important. It should not be like once a year. It should be like run probably more frequently, and the spread should be more the wider. Thank you.
Right, sir. So, Dr. Santosh, that we have now the next generation IV iron therapies, and they are being positioned more effective and better tolerated, than the traditional ones. So, from medical oncologist perspective, how do you foresee the role of this replacing the traditional oral iron treatments?
So, whenever we discuss about safer form of iron formulation, automatically my thought process goes back to maybe around 12 to 13 years back, where after completion of our MBBS, we have an internship posting where we rotate to various different specialties. One specialty posting is gynecology and obstetrics, where at that time the conventional iron formulation we were having in the form of iron dextran, iron sucrose, we're having little bit more reactions in the form of maybe around 15 to 20% develop some allergic reactions, which are minor, but around 1% might develop severe infection. So we had posting only for iron administration in the ward, morning 9 o'clock to evening 4. That was the load of iron deficiency. Thanks to the evolving research, and now we have very, very good, safer form of iron infusions. For my patients, there are two important things. One, the rapidity of correction of iron deficiency and improvement of hemoglobin, number one. The second one is safety of formulation. These are the two parameters that I take. Overviewing to the research over the past 1 decade, the free radical release of the previous iron formulation has much been reduced with the current iron formulation, with availability of possibly ferric carboxymaltose or ferric isomaltoside. With this formulations, there is rapidity and safety. So, which is the most essential for my patients. With this, what I would be able to achieve is to correct their iron deficiency more correctly, improve their hemoglobin, improve their general condition, resolve their fatigue, at the same time giving my chemotherapy schedules at the proper fixed time so that it would not be delayed. So the safer and rapid improvement of hemoglobin because of iron deficiency with newer iron formulations is a boon for my patients, as a result of which we can administer it more quickly, much more importantly, in a safer format with less resources. Previously, one doctor used to be appointed to see all the infusion reactions. With the safer formulation, we can give it in a much easier formulation and also in a pleasant way and in a rapid way.
Right. So ease of administration, less number of energy, that is the key takeaway. And this, every panelist is emphasizing on. So, Dr. Durga, what changes would you like to see in community level anemia screening and intervention strategies, especially for women and adolescents who form the bulk of at-risk population?
Yeah, so I think, as already previously emphasized, public health initiatives are one of the important aspect of covering the public. Uh, s- so one thing is educating the women, adolescents, and the college-going group, apart from the children, is important on what are the symptoms of anemia, why is it important, it can affect the scholastic performance, the daily performance of the individuals, and again what is the various symptoms, what are the various causes, how do we assess when one has anemia, how frequently should one get checked. And apart from this, yes, there should be a clear cut screening program that has to be implemented at a community level, which is not as such followed up routinely in India. But yes, there should be some community level screening program, especially for the women, pregnant women, the lactating mothers, and the adolescent or the growing age group children. And apart from that, there should all, anyways, the government has also focused on fortification of foods, and I think it's still going on. And apart from that, there should be a continuous supply of not only the oral iron and folic acid, but a proper supply and availability of the newer IV iron formulations is also required, and proper deworming strategies should also be encouraged. And primarily educating the community level workers like the ASHA workers, the Anganwadi workers, and whoever work at the community level to assess how should we assess anemia, what are the interventions, what are the possible causes that that particular community can be at facing anemia due to. So all these things are to be encouraged. So primarily educating, identifying anemia, letting them know the importance of treating an anemia, and proper deworming and supply of oral as well as IV iron formulation should be proper. And point of care devices to measure hemoglobin can be something which is more important and is a recent most advanced. Such things have to be incorporated at the community level.
Right, right. So deworming is one thing which can be done at a community level, that can lead to anemia. And definitely we should have diagnostic tools as well in place to diagnose anemia in time so that the treatment can be given, and IV, iron therapy can also be given if required, especially in severe anemias. Right. So my question to the audience, do you believe regular blood tests are important to stay healthy? Type agree or disagree in the comment box. So community level anemia screening is important. We have just discussed point of care testing is important because that helps us in mass screening. So our audience, please tell us, do you believe regular blood tests are important to stay healthy? Type agree or disagree in the comment box. All right. So, my next question goes to Dr. Sudhir Reddy. If you had to address a room full of general practitioners or public health stakeholders, what would your message be regarding timely anemia diagnosis and use of new iron therapies. Dr. Sudhir Reddy. Dr. Sudhir, are you there? I think there's some network issue. Okay, I'll come to him later. So, Dr. Srinath, are you there? All right. So, I'll ask Dr. Srinath, looking ahead, how can collaboration between pharma, hospital, and public health platforms will amplify national anemia control missions like Anaemia Mukt Bharat? So, please unmute yourself.
Oh, yeah, sorry. So I can talk of three I's in that context. One is innovation. So innovation has to be done by pharma, and hospitals and doctors, that is implementation. So for the implementation of that innovation, hospitals and doctors are the key players. And for information, you guys are the ones who run public health platforms, who have to take it to a large number of people who can really avail this, the newer innovations in medicine. So I think, it's not two eyes, but the three eyes which have to work together in tandem to really create awareness, innovation, and implementation. All three have to work in tandem to really overcome anemia. And I think this platform today has kind of worked as an example for what you have asked me.
So it is the collaboration which helps us, doing good to the patient, definitely. So, Dr. Vamshi, can you tell us that how long does the IV, infusion iron take to help anemia, control anemia rather? How long does it take?
Yeah, first thing is it depends on how severe is the iron deficiency. So we usually order a few blood tests to see the level of iron deficiency a patient has. So it depends again on whether it's what type of cancer and what is the type of anemia they have, or what sort of population we are seeing. And based on that, we decide what's the dose of iron which has to be given. And most of the times we see the response within a week to 10 days. The first improvement will be in their general well-being, and later we see the hemoglobin which rises. So based on the hemoglobin rise, we see whether the medicine has helped or not. And the infusion time is very shorter. I think it's probably less than an hour. There be in the hospital or the daycare center where we give this parental iron. So it's not a lot of time to receive this parental iron.
All right. And Dr. Durga, can you tell us that what iron levels require, like iron deficiency anemia, and what hemoglobin level, require IV transfusion?
So usually, whether IV transfusion is required or not depends primarily on the oral tolerance of the patients. If patients are tolerating oral iron, then oral iron is preferred. In case of any intolerance to oral iron in the form of nausea or constipation, diarrhea, that is when we prefer IV iron. And the hemoglobin cutoffs are different for individual set of population. So it is above 11 in women in general, and it is 13 in men. And pregnant women, especially, it is at 11. That is what we say as optimal cutoff. And anything below the required value is considered anemia, and it needs a correction. So whenever we see any case of anemia, we do evaluate for the causes of anemia, whether it is nutritional, and is it primarily iron deficiency alone, or is it also associated with the other important nutrients like B12 and folate deficiency, and accordingly correct. So as such, any anemia below the required value of 11 needs a correction, and whether it is IV or oral primarily depends upon how well the patient is tolerating oral iron.
Dr. Sudhir, are you there? Okay, Dr. Srinath, can you answer this question that if you have to address a room full of general practitioner or public health, I think Dr. Sudhir is there. Okay, I'll take this question with you only, sir. We have been waiting for you, Dr. Sudhir. So I wanted to ask you that
Yeah, madam,
if
please.
you want to address a room full of general practitioner or public health stakeholder, what would your message be regarding timely anemia diagnosis and use of IV therapies? Dr.
Basically,
Sudhir.
anemia is, I just want to tell the, can you hear me, madam?
Yes.
Madam, can you hear me?
Yes, yes, sir. Please.
I just want to tell the practitioners, some of the people who are involved in the active management of the anemia, that the anemia is not just the lab report. They need to identify the underlying cause, and they should not stop at the level of identifying my anemia as a diagnosis. There will be some underlying cause which needs to be identified and then treated accordingly. And second important point is iron deficiency anemia is not synonymous with dietary anemia. There may be some underlying causes which needs to be identified and then treated accordingly. So when it comes for evaluation, they should not stop at the level of only serum ferritin. They need to look at the serum iron, TIBC, transferrin saturation, and CRP levels to accurately identify and then definitively diagnose the underlying cause. So I think these are the things which I feel is important in the diagnosis. I mean, in the diagnosis of underlying causes of anemia. So when it comes to repletion of iron stores, I think the practitioner should be able to identify that whether the treatment which has been prescribed is being properly taken, and then is it being properly tolerated. Suppose if the patient has been started on some oral iron, if the patient is not able to tolerate that, they should be able to identify that at the early stage, and then only they have to start the treatment. I mean, they have to change the treatment to IV forms. Now, with the newer IV forms, the treatment is going to be faster, it is going to be effective, and it is going to be safe. They need not have to visit the clinic for multiple times. So, weekly dosings of these newer molecules make the clinical visits very less, and then the correction of anemia is also very accurate and then very faster. And these are the things which I want to emphasize the GPs, whoever are there, whoever are actively managing the patients of anemia.
So, so my question to audience is that do you think women are more likely to suffer from anemia than men? Type yes or no, whatever you feel is correct. I repeat my question. Do you think women are more likely to suffer from anemia than men? Type yes or no, whatever you feel is correct. I think we have few audience question as well. So I would ask my backend team to flash. Um, all right. So Dr. Durga, can you tell me that are vegetarians more prone to developing anemia?
So, yes, vegetarians can be more prone to develop a B12 deficiency anemia because the vegan diet or the vegetarian diet lacks primarily B12. Unlikely that they are prone to any iron deficiency or any other causes of anemia. Yes, that's the reason why we ask vegetarians to just get evaluated for anemia and also supplement B12 in case if it is low.
Any other question? So, Dr. Vamshi, can you tell me that do I always need to take iron tablets or can I manage anemia naturally?
Yeah, first is what is the level of iron we are looking at, and what is the target we are planning to achieve. So that's the most important thing we need to see. So Indian women, like 11 is called as normal, and for men 12. So this should be taken as the normal level for a normal population. And second thing is whether they have iron deficiency or not. So for which we will be testing with iron, serum ferritin, and the saturation. These are the tests which we usually do. So based on this, we decide whether they need any supplementation. So I think what one of the audience wants is whether they can manage anemia naturally. Yes, I think if the hemoglobin is 10-ish or so, and the iron deficiency is not that severe, I think we can do manage with the available foods like the green leafy vegetables, the carrot, beetroot, more keratin rich foods, we can try to supplement and again probably reassess after 3 months if they are asymptomatic. But if we are seeing someone who is having a hemoglobin of 8 or 9 and they need to improve their hemoglobin and they do have symptoms with severe iron deficiency, that's where probably we'll try to push either the parenteral iron or the iron tablets if they tolerate.
Any other questions? So, Dr. Shia, can you answer that why are women, especially during menstruation or pregnancy, more likely to become anemic?
So, am I audible? Yeah. So,
Yes.
during menstruation, obvious blood loss is the cause, and during pregnancy, the obvious increase in demand because of the baby uh, is the reason why women become more anemic, and they need more supplementation during those specific phases of life.
Any other question? All right. So I think I would like to take closing remark from each one of you because anemia is, a major public health challenge which we have to, address. And definitely newer therapies like IV iron therapy, and these are there to help us. So I'll start with Dr. Santosh first.
So I think through this platform, I want to drive one or two points. One of the important point is we have to view iron deficiency anemia as a symptom, not a diagnosis. We have to always try to evaluate what is the cause for iron deficiency. Is it nutritional or non-nutritional? Because this is the masquerading symptoms of some of the GI cancers, that is any cancer involving the stomach, food pipe, or the intestinal. That is the first point. Second important point is sometimes getting off an iron test or ferritin test is difficult in peripheral rural places. What we indirectly do is lot of they have a CBC machine. In the hemoglobin report, we will have a value known as MCV. If it is on the lower side, less than 70, possibly we are dealing with an iron deficiency anemia and start treating iron. Sometimes even getting test for ferritin might be difficult. Identification of early symptoms in the form of easy fatigability, jitteriness, unable to do their day-to-day activities or feeling fatigue towards the evening should possibly point for anemia. Rapid evaluation and correction by iron by safer IV formulation if they are not tolerating oral should be the way where we have to spread out on a national level so that we would decrease this anemia. And as our Prime Minister has told, Anemia Mukt Bharat we can achieve by using these strategies. Thank you.
Thank you, sir. So, Dr. Sudhir, would you like to add something?
Always consider IV iron early in the course of therapy in patients who do not tolerate or who do not respond to oral irons. Do not continue to give the same therapy thinking that the underlying anemia will be corrected. So always try to be more vigilant and then try to convert from oral to IV wherever it is necessary and wherever the faster correction is needed. Thank you.
Dr. Durga?
Yeah, fatigue is one under addressed symptom very commonly seen in the routine lives, but again iron deficiency anemia or anemia as such is one important thing. So it's always important to get a healthcare practitioner if there is any fatigue, get evaluated for anemia and accordingly get treated. And anemia especially in men is again important to get evaluated because as we know iron deficiency anemia is common in women because of menstruation, low nutritional intake, pregnancy and stuff. But in men, whenever we see any iron deficiency anemia, it's always important to rule out any blood loss, especially via the stool. So always evaluate the reason for iron deficiency anemia as already pointed by Dr. Santosh. And yes, this is the major takeaway from me.
And Dr. Srinath, your message?
So, from childhood, we are always hearing that prevention is better than cure. So I think the role of pediatricians in achieving Anemia Mukt Bharat is underrated. I think we have to kind of start focusing on iron replenishment right from the age of 6 months, and kind of give supplements, and as rightly pointed out in the previous discussions, that they have to be made available, and the awareness has to spread right from the age of 6 months to their adulthood. I think the supplementation has to start then, the awareness has to start then, and that helps us in reaching our goal of Anemia Mukt Bharat.
And Dr. Vamshi, your message for the audience?
Yeah, for the Anemia Mukt Bharat, the first thing starts with you. So what you have to do is just a simple examination of your hands, the palms, see how they are. So just compare with your friends or colleagues, see if they're looking paler or more whitish. So that's when we should be triggering whether you need to go for a test. So I think the place we are practicing, I think we see more of health checkups where at least I see the educated younger people going for routine blood tests very frequently, and they themselves do Google and they come us and say that you should be supplementing us with iron. So we are not looking at this population. So we need to reach to the rural areas where probably the people have access to social media, but unfortunately they are more busy in seeing the other famed social media, where I think probably we should have some reels about anemia and teach them how anemia looks and what do we need to treat anemia. So these are the reels which we should be pushing for Anemia Mukt Bharat, to reach to this lesser educated people who are more interested with the social media and they're fascinated by it. So that's the easiest way to educate them.
Excellent. So, on that note, I would like to emphasize that although anemia is common and it is widely prevalent, but it can be managed, all you need to do is go to a doctor and get yourself diagnosed. There can be an underlying cause. If you're female, you have to take care of yourself better. And definitely, diet helps. But if the anemia is severe, then we have next generation IV therapies. These are much safer, they have less allergic reactions, they are easy to administer, and doctor will tell you whether you need it or not, and they'll guide you how to treat it. So don't ignore simple fatigue or tiredness. There could be a reason to it. There could be a cause of some iron deficiency anemia. Please go to a doctor. So that is what, on this note, I would like to thank all my panelists for giving their insights and educating our audience about iron deficiency anemia. Thank you so much.
Thank you very
Thank
much.
you.
Thanks, Dr. Manisha, and
Thanks for
thanks.
having us. I think a great initiative. This has to be